Recently, at the annual meeting of the International Society of Periodontal Plastic Surgery, I made about a 14-minute presentation titled, "Yes, You Can Cure Your Gum Disease." For years, we as dentists, and especially as periodontists, have been telling patients that they can control their disease. And certainly, this is probably true, but think how motivational it would be if we could tell patients that they can cure the disease. Would they not be better motivated? Would they not be more compliant? Would they not get a better result? Would they not own their treatment? So you can go to my web textbook, pdmillerswebtextbook.com, and look up the link on there, "Yes, You Can Cure Your Periodontal Disease." Now, in doing that, it's because we have more sophisticated techniques, more oral rinses that make a difference, the sodium hypochlorite, which is found in chlorites, the impact that can do, killing the bacteria, the halitosis forming bacteria on the posterior part of the tongue. But one of the most key factors on this is you're going to see in a minute on a video by my colleague Lee Sheldon on perioscopy, or the use of a perioscope. Let's face it, the key to all periodontal treatment is to get a physiologic root, to get the calculus off. And the best way to do this is with this little camera in the Perioscope. This is an instrument that a highly trained hygienist can use quite well. And so without further ado, I want to introduce you to my colleague, Lee Sheldon, who is going to discuss a philosophy of treatment with the real focus being on the Perioscope. Take it from here, Lee.
Let's talk about periodontal disease. Periodontal disease is an infection of the outer surface of the tooth root. The bacteria from this infection accumulate on the root surface below the gum line. As a result, the ligament and bone support for the teeth gradually disappear. If the disease is not treated, the tooth loosens and ultimately is lost. Periodontal disease is highly treatable if detected early enough. We have many patients in our office who are told by others that they would have to lose their teeth. 30 years later, they're chewing and smiling with those same teeth. Your assistant will show you your Miller-McIntyre Periodontal Prognostic Index. This is scientifically based and gives you an excellent idea of your prognosis as well as your role in successfully treating this disease. While we are known for the most advanced dental implant care, we're very proud of the fact that we save teeth as well. And when we look at a patient, we look at you from both perspectives, saving teeth and or replacement with dental implants. Here are some of the state-of-the-art items that we may use in helping you to treat your disease. First is the oral DNA test. This test determines the type and quantity of periodontal disease bacteria in your mouth. You spit in a cup, we send that bacterial sample out to the lab, and we find out what bacteria is growing there. If we find that you have one of the aggressive types of bacteria, we'll prescribe an appropriate antibiotic to help kill that bacteria that's lodged in your gum tissue. This step will help you to avoid periodontal surgery and laser treatment. The bacteria that invades your tissues may go through your bloodstream and increase your risk of other diseases such as heart disease, diabetes, Alzheimer's, and lung problems. So getting rid of this bacteria may help your general health as well. And this bacteria that causes periodontal disease can also be spread to others through your saliva. Some people are curious as to why the periodontal infection can't be totally controlled with antibiotics. The reason is that much of the bacteria is attached to the surface of the root of the tooth. Antibiotics can't reach that bacteria. For that part of the treatment, we rely on highly skilled, highly trained hygienists who are experts in a unique treatment called perioscopy. Perioscopy uses a perioscope. The perioscope is a marvelous invention, and it's the key to the non-surgical treatment of your periodontal disease. It's a tiny camera that's placed below your gum line and magnifies your root surface by a power of 40. That means that your hygienist can explore every portion of your tooth below the gum line and identify the hard bacteria called calculus that is attached to your root surface. This calculus is removed with delicate instruments called curettes to make your root surface bacteria-free. The tissue and bone are more likely to heal against a clean, smooth root surface. What can you do to help control your disease yourself? The first step is thorough oral hygiene at home. Completely cleaning each tooth once a day using the implements that we will select for you will go a long way to helping you to prevent reinfection. Smoking is a big part of controlling periodontal disease as well. A smoker has a 246% greater chance of losing teeth than a non-smoker. If you've wanted to quit, now may be the time to do so to help save your teeth. One resource to help you stop smoking is a phone call to 1-800-QUIT-NOW. The third step is your diet. Periodontal disease is a chronic disease, and just as a healthy diet is important for your overall health, it's also important for your teeth and gums. We can help you find resources to help you improve in that area as well. So there you have it. A comprehensive, predictable, non-surgical method of saving your teeth. It's comfortable and it works. If you have any questions, please ask your assistant or one of our doctors. We are committed to helping you smile and chew for a lifetime.